What is cervical cancer and how is it prevented? A cancer that develops on cervix cells is called cervical cancer. Typically, this cancer develops slowly and doesn't manifest symptoms until an advanced stage. Early cervical cancer detection is crucial to prevent significant issues from developing. The part of the rahim that is connected to the vagina is called a cervix. In order to facilitate sperm transport from the vagina to the uterus during sexual contact, it is designed to produce a fluid. Additionally, the function of cervix is to protect against bacteria and foreign body odor. Cervical cancer or cervical cancer is one of the most frequent types of cancer in women. Based on research in 2020, there have been more than 600,000 cases of cervical cancer with 342,000 deaths worldwide. There are two forms of cervical cancer, namely, cancer of the squamous cell, KSS. The most typical kind of cervical cancer is squamous cell carcinoma. The cervical squamous cell, which borders the exterior of the cervix, is where KSS starts. Adenocarcinoma. In the cervical canal, glandular cells give rise to the cervical cancer subtype known as adenocarcinoma. The two aforementioned kinds of cervical cancer can coexist, albeit this is uncommon. Other than squamous or glandular cells in the cervix, cancer can also develop, but this is extremely uncommon. Cervical cancer occurs when healthy cells undergo changes or mutations. This mutation causes these cells to grow abnormally and uncontrollably, thus forming cancer cells. It is not yet known what caused the changes in the gene. However, this condition is known to be associated with HPV infection. Depending on the stage of the disease, a person with cervical cancer has a variable life expectancy. This number represents the proportion of cervical cancer patients who are still living 5 years after their diagnosis. For instance, a life expectancy of 80% suggests that 80 out of 100 patients with cervical cancer survive for at least 5 years after their diagnosis. According to the stage of the disease, the following are the life expectancy rates for those with cervical cancer. Stage 1, 80 to 93%, Stage 2, 58 to 63%, Stage 3, 32 to 35%, Stage 4, less than or equal to 16%. The course of treatment for cervical cancer is determined by the patient's health in the stage of the disease. Chemotherapy, radiation, surgery, or a mix of the three are among the procedures the doctor performs. If cervical cancer is discovered early, survivors' chances of recovering are higher. Therefore, starting at age 21 or after marriage, it is recommended that all women have routine cervical cancer screenings. Additionally, starting at the age of 10, a vaccine can be used to prevent HPV infection, which can lead to this malignancy.